Our sixth category here today is excellence in commissioning. This category recognises that commissioning is at the heart of the key improvements that we want to see in health and social care services. The finalists are NHS Knowsley and Knowsley Practice-Based Commissioners, Central and Eastern Cheshire PCT, Cheshire East Community Health and HMP Style, NHS Cumbria with the Allerdale Celiac Steering Group. Let's have a closer look at these nominations.
Part of the thinking with public-based commissioning was that if we're going to devise service for people who live locally, then it's important to know how they feel about those services and how they want to use those services and how they think it will work better for them. They've been involved right from the beginning and up to the end. Even the procurement stage, the patient representative was on the panel that interviewed the providers of the service.
I was interviewing the people who were hoping to win a huge service. These are professionals, senior, I imagine director level in health authorities and service providers, and questioning them on the same level, and having to be given a response that was meaningful. You couldn't be brushed off.
We don't want wastage in the system. We want people to actually use the system. There's no point having a shining building somewhere where nobody goes to. But if the patients are involved with the beginning of the designing of the building, for instance, they choose the colors, they choose the chairs that they want to sit on. I mean, they get the ownership, because after all, it's our NHS. It's for everybody. And so the patients actually, I'm a patient myself, so when I want to use a service, I want a service that will work for me. Not as a doctor, but as a patient. And so patients will always come first.
It's a different environment for us. And seeing patients far more relaxed, far less intimidated, and genuinely giving us really positive feedback during their clinic visits is really tremendous and actually quite unusual.
In 2006, the Primary Care Trust took over the responsibility for the commissioning of healthcare services within Style, and the main aim for the PCT was to try and achieve the equivalent healthcare for those women as best as possible that can be achieved within a prison setting. There was many issues that needed to be resolved to improve the services and to enhance the amount of care that was available to the women in Style. The improvement around the drug treatment service was seen as very much as key. Immunisations and the increasing the number of immunisations available to the women in Style was seen as important. A transition at the point of discharge was also very important. A lot of the women in Style are only here for a very short period of time, and it is important for their continuity of care that a transition arrangement and information is provided at the point of discharge.
Once I was in post for health promotion, one of my main ideas was to give the women enough information once they were released to the area they were released to. I felt that they weren't getting enough, so I broke down the northwest area because most of the women are released into the northwest, and I looked at the prison service orders for health promotion and worked out that we needed how to register with a GP, a dentist, local stop smoking, sexual health stroke well women's clinic, recreational centre and education or learn direct centre. So I got all the information for those centres, addresses, telephone numbers, times that they were open, and put them into area specific, so when they go into the pack they get those on release.
Key to the success of the healthcare services within HMP Style is the establishment of effective relationships between the key organisational players such as the prison, the healthcare provider and the healthcare commissioner. And historically those organisations have fairly different cultural backgrounds. And so on a local level, what we've really tried to do is to understand those and work with each other and establish a trusting relationship where we can work together both in operational delivery but also in planning the way ahead. And so that exists at a strategic level, but on an operational level that translates into real cooperation between our colleagues who on a day-to-day basis are providing the service. An example of this effective working relationship at an operational level is the improvements in the sexual health services and in the uptake of the hepatitis B vaccine. That close working relationship has meant that Style is now consistently within the top 5% of prisons nationally in terms of the number of hepatitis B vaccines that we deliver.
Well, the celiac patient comes in with a prescription form, our own design, that enables them to work out how many products they want. They present that, we advise them if there's likely to be any difficulties with any of the products, and then tell them that we'll probably have it ready within a day or so. Away they go, we get the stuff in. Any problems in terms of supply we can resolve when they come back. We can get alternative products. Like most pharmacies, we have a consultation room and we can take patients in there and discuss any aspect of the treatment that they want to seek enlightenment or reassurance about. It makes the system much easier for them to operate. It gives them much greater choice. Under the prescription system, it can be difficult to change from one product to another.
Celiac disease is a lifelong condition which affects about 1% of the population. The treatment is simple. It merely involves eliminating gluten from the diet. But in order to do this, it does involve special prescriptions of gluten-free products and educating patients to eat foods which do not contain any gluten at all. What this scheme is about is really empowering patients to take charge of their own healthcare. It frees up time which was previously spent on writing complicated prescriptions. It frees up the doctor's time, frees up the patient's time in obtaining the prescriptions, and it also engages the pharmacists in spending their time in delivering healthcare rather than just delivering gluten-free products. So it's a very effective scheme and it empowers patients in managing their own healthcare.
And the winner of the 2010 Excellence in Commissioning Award is NHS Knowsley and Knowsley Practice-Based Commissioners. Well done, Knowsley.